Meniere's disease affects about less than 1% of people in the US, and it is more common in older, white, and female patients. It occurs when there is excess accumulation of a fluid called endolymphatic fluid within an inner ear structure called the semicircular canal. The cause of this excess fluid buildup is unknown, but when it does occur, it leads to the classic symptoms of dizziness and ringing sensation in the affected ear. So how does Meniere's disease come about? To better understand how this condition comes about, let's first look at the basic overall structure and function of the ear and the vestibular nerve. The ear performs two basic functions. Firstly, it assists in hearing, and secondly, in maintaining balance. These two major functions make up the auditory system and the vestibular system, respectively. The auditory system and the vestibular system are controlled by an important structure called the vestibulocochlear nerve. The vestibulocochlear nerve is made up of two branches, the cochlear branch, cochlear nerve, and the vestibular branch, vestibular nerve, which control hearing and balance, respectively. The vestibular system, which helps maintain balance, consists of three main structures called the semicircular canal, the utricles, and the sacculars. The semicircular canals consists of fluid-filled tube-like structures lined with hair-like receptors. These tubes are filled with a fluid substance called the endolymphatic fluid. These hair-like receptors sway in various directions in response to specific rotational body movements. The swaying motion of these receptors in turn relays sensory signals to the vestibular nerve, which in turn transmits these precise positional sensory signals to the brain for interpretation to help maintain balance. The utricles and saccules likewise consist of fluid-filled tube-like structures that are lined with hair-like receptor, but coated with tiny little floating calcium carbonate crystals. The orientation and position of these calcium carbonate crystals at any moment in time is in relation to gravity. The swaying motion of these hair-like projections and the calcium carbonate crystals in turn relay sensory signals to the vestibular nerve, which in turn transmits these precise positional sensory signals to the brain for interpretation to help maintain balance. In Meniere's disease, there is excess buildup of endolymphatic fluid within the semicircular canals, the utricles and the saccules, leading to distortion of these inner ear structures, hence triggering symptoms of dizziness. What are the symptoms of Meniere's disease? Common symptoms include recurrent dizzy spells lasting from minutes to hours at a time, accompanied by changes in hearing ability, ear-ringing sounds, known as tinnitus, and a strange earfulness sensation. How is Meniere's disease diagnosed? The diagnosis is based on clinical findings, such as a description of the symptoms experienced by the patient, the potential symptom triggers, and any abnormal findings on physical examination such as hearing loss. How do we treat Meniere's disease? We focus on two very important aspects when it comes to treatment. Firstly, educating the patient on the underlying cause, mechanism, management and prevention of Meniere's disease, such as limiting your daily salt intake, is very important. Secondly, focusing on controlling other symptoms that are discomforting to the patient, such as nausea and dizziness, is also of paramount importance. Thirdly, in patients who still experience symptoms of Meniere's disease, despite limiting their salt intake, trying other medications that have been shown to be effective in controlling symptoms can be considered as an alternative, such as fluid pills like diuretics, such as Lasix. As a final resort, surgical treatment is an option in severe and uncontrollable cases. Will my Meniere's disease ever go away? Well, the good news is that in most patients, as the time progresses, the intensity and frequency of the symptoms gradually subsides. Here are a few questions you may ask your doctor about Meniere's disease. What is the cause of my symptoms? Can my symptoms recur after it is treated? What are my treatment options? How can I prevent these symptoms from recurring? Can a stroke cause similar symptoms? And if so, how can I tell the difference? What should I do if I think my symptoms are due to a stroke? Here are 5 take-home points on Meniere's disease. Firstly, Meniere's disease is caused by excessive fluid buildup in the ear. Secondly, common symptoms include recurrent dizzy spells lasting for minutes to hours, fluctuating hearing loss, and ringing sound in the ear. Thirdly, diagnosis is based on clinical examination of the patient and how they describe their symptoms. Fourthly, treatment typically involves use of fluid pills to help drain the excess fluid buildup in the ear. Finally, over time, symptoms gradually stabilize and improve, but this may take years. Ready to try a few practice quiz questions on this topic to test your understanding? Question 1. What is Meniere's disease? A. A condition that causes excessive sweating. B. A condition that causes a person to pass out when running. C. A type of dizziness that occurs due to excess buildup of fluid in certain structures located inside the ear. D. A type of severe headache that causes nausea. E. A condition that causes the heart to beat fast even while sleeping. The answer is C.
Question 2. Meniere's disease is more common in which population group?
A. Younger patients. B. Older patients. C. Asian patients. D. Male patients. E. Stroke patients. The answer is B. Question 3. How do we diagnose Meniere's disease? A. By performing an X-ray imaging of the back. By performing an eye exam. C. By performing an MRI imaging of the brain. D. By performing a blood test, checking for the kidney function. E. By obtaining a thorough description of the medical history and symptoms experienced by the patient. The answer is E. Question 4. Which of the following is a medication that can be used to manage Meniere's disease? A. Lasix. D. Tylenol. C. Aspirin. D. Antibiotics. E. An inhaler. The answer is A. Question 5. What are some symptoms of Meniere's disease? A. Severe headache. B. Dizziness, hearing loss, ringing of the ear. C. Runny nose. D. Severe coughing spells. E. Severe vomiting. The answer is B. Thank you for taking the time to learn with us today. We hope that the information presented today was of help to you. If you found this information helpful, click the like and subscribe button for more videos. Until next time.